Good morning, good afternoon, good evening. Welcome to our webinar, which is titled Missed Opportunities, COVID-19 as an Accelerator or Blocker in Inclusion of Forcibly Displaced in Linking Social Protection and Humanitarian Cash Transfers. My name is Zara Rizvi. I work with the Grand Bargain Cash Subgroup on linking social protection and humanitarian cash transfers. And we, as we normally do, we are actually going to start off with a poll. And I'm the one who's supposed to be running this poll, so let me go ahead and launch the poll. We do this poll because it's just a good idea for us to understand who is joining us today, so that the speakers, our wonderful panel of, the wonderful panel that we have, that they know how to tailor their comments and interventions. So if you can select, if you are a social protection actor, a humanitarian actor, if you're one of those rare people who is a mixed profile and I self-identify as both social protection and humanitarian, or if you are neither. I'm going to let this run for a couple more seconds. It seems that at least 60% of you have voted, and it keeps going up. So I'm going to go ahead and close that in 5, 4, 3, 2, 1 seconds. And to share the results so that everybody has a pretty good idea, we have, it keeps going up, the mixed profile. So this is excellent to see that 23% of you identify as having expertise or at least a specialism in both the social protection and humanitarian side. So I will go ahead and hide those results and we can get started. Can I get the next slide, please? So the Grand Bargain subgroup is, this is part of our webinar series. The Grand Bargain subgroup came out of the process of the World Humanitarian Summit in 2016. It is a group that is made up of a bunch of different agencies, both from the social protection and humanitarian side. And we have, sorry, 1 second. Yeah, so we're going to have a little bit of an issue with changing our slides, but that's quite all right. One of the computers in the back end is frozen, but I will continue to keep talking. So it came out of the process of the World Humanitarian Summit. It is a group that is made out of a bunch of different agencies, both on the social protection side and the humanitarian side. It is co-led by IFRC, UNICEF, and DFID. One of the key things that was coming out of the group is that we don't have enough information and products and understanding for humanitarian practitioners in particular on how are we linking social protection and humanitarian cash transfers. So UNICEF manages this process. It's managed by UNICEF and funded by DFID, the knowledge management and learning. These webinars are one of the things that, one of the products that we have been putting out. This is our 7th webinar that we are doing. We have other products that we have, and as the socialprotection.org team is able to do this, they will. We're going to put our products in the chat box. We have a weekly newsletter since COVID that has started coming out, and send us an email. We will subscribe you to our list. We have a mapping that we are also doing. It's a live editable Google document that we have to be able to do the mapping. So we'll put that out there. We also collaborate as much as possible with different initiatives and actors. And one of the things that we've been able to do is get linked to this socialprotection.org also has a COVID series for their webinars, which normally happens on a Tuesday, but we have been able to link some of our webinars to their sp.org COVID series. And that series, this is the 15th webinar of that series, and it's a joint effort that is initiated by the IPC-IG GIZ on behalf of the German Federal Ministry for Economic Cooperation and Development, which is BMZ, and the Australian government's Department of Foreign Affairs and Trade, DFAT. This webinar, the webinar series, is part of an initiative with other 2 major components. So SP.org also has a collaborative mapping of country news and documents, and this is disseminated weekly through their dedicated newsletter. It is an excellent resource. I would highly recommend that people sign up for it. They also have an online community on the topic to systemize information and foster discussion. You can also join that online community. They have additional webinars coming up. The next webinar of their series will take place on the 23rd of June, one on the 25th, and one on the 30th and 2nd of July. And those topics are on school feeding programs, social contracts in South Asia, migration, and universal health coverage. So once our backend gets sorted, you'll be able to get those links and see what to do with that. I'm going to go ahead and introduce our panelists, actually. And we are going to start with Mr. Mamadou Diane Balde from UNHCR. Mamadou, if you can just wave at us, and then we know that that is you. Mamadou is the Deputy Director of UNHCR's Division of Resilience and Solutions. In this capacity, he oversees and supports UNHCR's global programs on education, livelihoods, and economic inclusion, social protection, etc. Prior to his current responsibilities, he's worked for UNHCR for over 20 years, field postings in Africa, Asia, and in HQ. His most recent assignments have included the Deputy Director of the Comprehensive Responses Task Team in Geneva. He was UNHCR's Assistant Representative for Protection in Ethiopia, and there is a big list of other things that I'm not going to get into because we try and keep this one brief, but needless to say, thank you very much, Mamadou, for being here, and we look forward to your interventions. I will next introduce, in order of who will be speaking, is Ferdila Ouattara. Very excited to have Ferdila here. She is currently, she works with UNHCR. She's a Senior Protection Officer in their operations in the Republic of Congo. She's been with UNHCR since November 2006, mainly in the field of international protection, ensuring that refugees and internally displaced people's rights are respected, protected, and fulfilled. In Côte d'Ivoire, Chad, Niger, DRC, CAR, and now in the Republic of Congo, she has worked closely with refugees, civil society organizations, and authorities at local and national level to ensure that forced displacement matters were handled with the required attention. Thank you, Ferdila. If you can just, there we go, we've got you on board. And it is my immense pleasure to be able to introduce our third speaker, who is Thais Braga. She is graduated, she works for AVSI, Brazil. She has graduated in international relations and holds a master's in public policy and administration from the University of London. She's worked in the third sector and in the public sector in Brazil and Mozambique, and has experience with UN agencies such as UNDP and UNFPA. Currently, Thais is the manager of the project Promoting Integration Through Employment of Venezuelan Refugees and Migrants and Other Vulnerable Persons in Brazil at AVSI Brazil. So Thais, it is, thank you so much for joining. And if you can just wave, because it's important that we can get the perspective, not just of UN agencies and different INGOs, but also an NGO. I don't know if we can get to the next slide, but we should be able to. And before I go, I do need to introduce Andrew Mitchell. Sorry, I don't have you written down on my sheet over here, but Andrew is a senior social protection specialist at UNHCR. He has been my co-collaborator on pulling together this webinar. Thank you so much, Andrew, for all the work that you have put in, because we are co-hosting this one with UNHCR. There is also, because I didn't have the slide in front of me while I was doing this, there is different social media links and things like that that will all get posted into the chat box, so everybody will have that eventually. Oh, it looks like we're going backwards in the slides to be able to do that. But yeah, all of our products and all of the stuff that we've spoken about, you'll be able to find it over there. If we can go back to the objectives slide, please. So one of the things we're going to do or not one, but what we are looking to do in this webinar, it is very much connected to the one that happened 2 days ago on responses to COVID. And it was UNHCR was presenting their different ways in which they have emerging field practice around cash-based interventions and what they're looking at. We really wanted to take that webinar and move it one step forward. And what we're looking to do is promote an overall vision of inclusion in social protection systems via humanitarian and development efforts, where COVID is an additional accelerator, blocker, or it opens up new opportunities for inclusion. We're going to look to share and promote examples in terms of good practices and any missed opportunities. We'll look at the different kinds of funding mechanisms that are available. And I have to say, in the last 2 weeks, I've learned quite a bit in terms of with the planning and everything that we've been doing. And one of the big pieces of funding that we're going to talk about is World Bank funding and their IDA window. We will also look at the medium-term implications for the socio-economic impacts of COVID for forcibly displaced populations. We have focused quite a bit on the short term and looking at social assistance programming, social safety nets and things like that, and what does inclusion look like. And we wanted to start taking the conversation more towards the medium term interventions. We're not sure we're quite at the long term yet. We need to think about it, but we wanted to start shifting our focus to, okay, we've seen these massive social protection systems expanding. So what do we need to start thinking about for the medium term as well? What does that look like? What do labor market interventions look like? Everybody has around 10 minutes to be able to present. We do want to leave it discussion heavy, as we normally like to do. So please continue to send us your questions, etc., as we are going through, because we will take them towards the end. And with that, for the rest of us to turn off our cameras, Mamadou, I hand over to you to start us off. Thank you.
Thank you. Thank you very much, Zahra. It is really a great pleasure to join you all and to speak about forced displacement and how we can make sure that we do not miss the opportunities for inclusion for displaced persons, and thinking mostly about refugees and asylum seekers. Here I want to start by indicating that earlier today UNHCR released the global trends relating to forced displacement, and unfortunately we are finding that forced displacement is now affecting more than 1% of humanity. This is unprecedented. 79.5 million were displaced, with fewer and fewer of those who flee being able to return home or to be locally integrated or to find a third country durable solutions. This is really unprecedented, and the global trends were just released today. It is also reaffirming and confirming things that we knew some time ago, that more than 3/4 of the world's refugees, in fact 77%, are caught up in situations of long-term displacement, and 85 of them are staying and living in the developing countries. It shows you why we had a few years ago the New York Declaration with its emphasis on easing the pressure on host countries. I also wanted to highlight that if countries are not able to really respond to the needs for inclusion and self-reliance for refugees and refugee hosting areas, we will not be having greater chances of moving towards this SDGs, the Sustainable Development Goals. And we have now, as you know well, a new indicator on refugees that has been approved by the UN Statistical Commission, which is about strengthening again the leaving no one behind in the Sustainable Development Goals. My second message here is that with the appearance of COVID-19, we have really realized that refugees, displaced persons are disproportionately impacted by COVID in relation to health, but also in relation to the socio-economic impact of the pandemic. For example, in the Americas, we have more than 80% of UNHCR's persons of concern who live in urban centers, and many of them have lost their jobs in the informal sector because they are daily wage earners, and this is due to lockdown, but also some of the impact of the lockdowns. It is the same situation and impact that we have seen in Lebanon, in Jordan, countries that are hosting large number of Syrian refugees. It is the same situation we are seeing in the Eastern Horn of Africa, which are hosting a large number of South Sudanese and Somali refugees, but also in Southern Africa and in Europe. So forcibly displaced persons, unfortunately, are being disproportionately impacted by COVID and COVID-19. And with losing their livelihoods, refugees being asked really to leave, vacate their houses, this is having negative impact on in relation to the food security, but also to their ability to be able to earn better living conditions, but also to take care of their own families. I wanted also to highlight here that the COVID social protection responses that are required in order not to miss the opportunities are building on pre-COVID inclusion efforts. What is happening is that UNHCR for the past few years, with the support of the international community, has been able to work out, and then with partners, governments, to say that through the New York Declaration, through the Global Compact on Refugees, through the first Global Refugee Forum just last December, that refugees, forcibly displaced persons, should have access to inclusion measures, that they should not be left behind, and that they should be as much as possible included into the societies that host them. We know, for example, that as long as refugees are able to access health measures, cash transfers are not discriminated against when there are public work schemes and trainings, we have possibilities really to support them and to be better. The other point I wanted also to raise here is that COVID special protection measures really are building on what we have seen in relation to the rollout of the World Bank IDA 18 refugee sub-window, as well as what we are going to anticipate in relation to the World Bank IDA 19 refugee sub-window. Next, please. You will see that as the next slide is coming, if it is not frozen, that we would like to propose 3 measures in order to help us really make sure that refugees do not miss the opportunities of inclusion, and that in fact the COVID-19 responses are helping with as accelerators for inclusion. One of them is that we need flexible enrollment registration processes to access benefit. That's really the first key measures. In relation to that, we know, for example, that Portugal has provided us with an opportunity to learn, and in addition to Portugal, several other governments. We know that if refugees are able to be allowed to extend the validity of their documents, including those relating to the asylum systems and residence permit, we will have the opportunity for them to be temporarily as well as to the medium and long term included into the social protection measures. So this is really a key measures, I think, that will help us move beyond the exclusion part of forcibly displaced persons within the responses to COVID. Another measure that we believe is extremely important is that social assistance and to meet basic needs and reduce protection risks are really extremely important. This is the second type of measures. I know that our colleagues in Brazil, TAI, as well as Ferdila will speak to that. But the most important for me here is to say that we need to support host communities and refugees for social cohesion. We also need to go for the short to long-term measures for all needs, including COVID-19 related one. We know, for example, that providing short-term, medium-term type of support to refugees and hosts really help them in relation to to social cohesion as well as social protection. Next slide, please. Okay, I think there is some, yeah. Okay, so here I wanted to say a bit about what we have in, as an example, in Mauritania. We know, for example, that in Mauritania, the government COVID-19 response has really helped 2 rounds of cash transfers to refugee hosting areas. We have seen it work, and we have seen it making a real difference vis-a-vis urban refugees, and that the continuation of the cash and in-kind type of support to rural refugees around Beira camps will really make a difference. We also see some windows of opportunities in the new or under making IDA 18 social safety net program that will be progressively include refugees and refugee hosting areas into the government-led cash transfers, thanks to support from the international community. Next one, please. We also have some additional examples in relation to the key measures 2. 3 is that we need to have livelihoods and labor market type of support to boost income and self-reliance. This is going to end the presentation I'm going to make, but please note that in several countries, for example, we have in Kenya, India, Malaysia, and 12 other countries, MAID 51 has helped. MAID 51, which is a product scheme that has been developed by UNHCR, has really helped refugee artisans contribute to not only the communities that are hosting them, but for their own populations, their own families, but also to be able to produce, for example, masks, as well as supporting local economies. We have in several places in Cameroon, for example, there have been a government-made type of tripartite support to help refugees access access the production of masks, as well as the use of some of the support for self-reliance. Finally, I wanted to say that the emphasis that that some of the authorities we have seen in light of all this is that protection and impact monitoring are critical. Use of data and analysis is important, and that we need to be able to see how humanitarian actors can contribute to the measures that government are taking, but also that development partners are taking. In a summary, I wanted to say that what the key message here are really 3. One is to say that we are having more and more refugees, and today we have listened to that. We have seen the unprecedented number of refugees appearing. 2, it is that refugees are being disproportionately affected in relation to health, but also socioeconomic related impact by COVID-19, and that if we do not want to miss the opportunities, we need to take a certain number of measures. One of them is to have a very good and flexible registration and enrollment related measures. And a second one, as indicated earlier, we need to make sure that we are able to support some of the responses that are being made, and in making these responses, we should not let refugees, forcibly displaced persons aside. And that thirdly, we need to be making sure that we all work together towards the inclusion of refugees into the social protection schemes. Zahra, over to you, and I will be very glad to not only complement some of the examples that are going to come, but also you have heard about Portugal, Mauritania. There are many more that exist that will be helpful to sustain the point we are making. Thank you very much, Zara.
Thank you, Mamadou, for that and for setting up the framework in terms of, one of the things is we've looked at least on the humanitarian side, it's been very much around are we getting the coverage that we need with the big social protection expansion? And I think this nuance of there are different legal frameworks that we need to consider for the forcibly displaced. And as you're saying, they can be disproportionately more affected. So I think this gives us a really good framing in order to be able to take the examples that you've already presented, but also the examples that came up in the webinar 2 days ago in terms of complementing and aligning to government responses in Pakistan and in Morocco, Rwanda, I think as well. Hannah Matinan from UNHCR had presented around that. And it would be good then to get Fadila, Fadila, if we can get you on to be able to present the case study from Republic of Congo, and then we can take it further from there.
Thank you, Zara, for the word, for the floor. So my name is Fadila Ouattara, and I'm working for UNHCR in the Republic of Congo, in Brazzaville currently. And I'm going to talk to you about how inclusion of refugees was made possible in the Republic of Congo in the Social Safety Net Program. So I'm starting by presenting quickly the asylum history in the country. Then I will go to the history of social protection and the Social Safety Net Program here. Then I'm going to talk quickly about the inclusion process and how it became possible. Talked about also about the COVID-19 impact of this inclusion process. And at the end of my presentation, I hope I will still be on time in the time frame. I will talk about mid and long-term prospects that we are seeing here in the Congo. So talking about the history of refugees' presence in the Republic of Congo. The country has been receiving refugees since the 70s. So basically the Angolan refugees came here. Then we had several waves of DRC refugees, several waves of refugees from Central African Republic. And also we had refugees from Rwanda. In fact, they were coming from the eastern part of DRC, but they found themselves here in the Congo. So UNHCR has been supporting the country here in organizing repatriation operations. We have a lot of repatriation operations going on here. But at the end of the day, you will always have refugees who would like to stay in the country. So we were really looking at ways to accompany this stay here. And another thing also that's like pushed us to find solutions here was also the fact that UNHCR is really investing in the northern part of the country. If you see on the presentation where you have the most the greater number of arrows is in the northern part of the country, where we have 75 to 60 to 70, 65 to 70% of the refugee population. They are living in this part of the country. Unfortunately, because it's a remote location, they are not really receiving an important support from the government. And the department itself, including the host community, the refugees, there is almost nobody there. So UNHCR is like involved in the health support, education support. We are supporting the national system that is almost non-existent in this part of the country, just to ensure that the refugees are included and the host community can also benefit from it. So because of all these reasons, we're very looking at ways to accompany the refugee inclusion, like economic inclusion in the country. And that's how in 2014, the government started implementing the Social Safety Net project. If I can have the next slide, please. So the project's name is Lisungi. Lisungi in Lingala means support or help. So Lisungi started in the country in 2014, and they received funding from the World Bank initially. It was funded by the World Bank and the government initially. Then they received additional support from the French Agency of Development. They received an additional support from the World Bank again. So we were trying to advocate for the inclusion of the refugees in this social safety net program. But we were said that it was not possible. And this was the answer from the government, because they were of the view that this project was meant for Congolese nationals and not for foreigners, not for refugees. So it took us quite some years of negotiations, and we didn't really have any remarkable fruits in our negotiations. But in 2017 and 2016, that's where the process is starting. Mamadou was mentioning the summit, the New York Declaration. The World Bank made a commitment to support forced displacement issues, and they came up with this sub-window, the IDA 18 sub-window for host communities and refugees. And if I can have the next slide, please. So the Republic of Congo was among the 8 first eligible countries for this IDA 18 fund. And I think that's where the whole process really started, because once the World Bank was involved in the discussion, the government really listened to whatever the World Bank had to say, because it's the World Bank. They're coming with a lot of money, so it was like, okay, let's listen to whatever they are saying. So we started with the World Bank, this collaboration, discussing, try to find where the money should be channeled to, because there were a lot of proposals coming from the governments. They wanted to, for example, enhance the refugee status determination system. They wanted to have a support for the asylum law, which are very interesting projects. But at the end of the day, with the World Bank, we were really looking at ways to ensure that the refugees and the host communities will be able to get a concrete support from whatever projects that could be identified. So the main project that was identified by the World Bank and UNHCR was Lisungi, because it was already operating. Unfortunately, it was not in the northern part of the country. So the agreement was that Lisungi will be extended to the northern part of the country. So you see in yellow, the yellow part is where the Lisungi has been, the extension with the IDA 18 fund will be implemented. So we had this discussion for like almost 2 years, 2017 to 2019, the appraisal part, the assessment part, and the project was approved like for implementation by the board of the bank in December 2019, so which a few months ago. So we were about to start the process when we had the launching, the official launch of the project on the 27th December 2020, and unfortunately we had to stop because of the COVID situation. Nobody was able to get to the northern part of the country. We're supposed to travel with the government, with the World Bank, and start the implementation right away. But unfortunately, we were not able to do so. So we had to find another way. And if I can have the next slide, please. So the next slide will be more on the COVID situation here in the Republic of Congo. If you see the dots, COVID has been impacting mainly the southern part of the country, in urban places, basically Brazzaville, the capital city, and Pointe-Noire, which is the second largest town in the country. So because COVID was really impacted this part of the country, the government kind of tailored its response, like the health response and the socioeconomic response to only this part of the country. And they put in place an emergency social safety net for the people who are affected by the COVID-19. So when we heard about it, we were discussing with the World Bank. The World Bank told us that the government was trying to find a way to to support the household in Brazzaville and Pointe-Noire. So we reached out to the government to say, hey, people, please, can you include the refugees in this emergency support? And it was a very pleasant surprise to hear that they were already thinking about that. The fact that they included the refugees in all the process, from the identification, everything, all the tools that they developed, they think about the refugees and even about the other foreigners, including the asylum seekers in the Republic of Congo. So from what we understood, the fact that we had this long discussion from 2017 to 2019, trying to tell them that it was important for refugees to be included in the social safety net program and in other programs here, this discussion really yielded fruits, as we saw when the COVID situation came in the country. So right now, the refugees will benefit from the support that the household in Brazzaville and Pointe-Noire who are affected by the COVID situation will receive. And we are talking about economic vulnerability, household. They are doing a household survey, including the refugees who are also receiving the survey in the houses. So they will ensure that anybody who is found eligible by the project will receive the support. If I can have the next slide, please. So our role as UNHCR in the process, we didn't get ourselves too much involved in the process. We ensured that the refugees had the information, and also we ensured that we kind of set up a monitoring system, calling the refugees just to ensure that they were involved. For example, because the community leaders were the ones to identify the people. So just to ensure that the community leaders they contacted the refugees. And when it was not done, we also had our way to go back to the government to tell them, in this part of Brazzaville, in this other part of Brazzaville, it didn't work well, so please, can you consider so person from our database? So that's what we are doing right now. So coming to mid and long-term prospects, so the government is expecting an additional support from the World Bank to continue this COVID-19 support. And as I was saying, we are also waiting for the right time to go in the northern part of the country to really launch this IDA 18 project. Basically, it's cash to enhance the access to education and health, and it's also cash for income generating activities. And we also hope that the World Bank will increase its support in that part of the country that is hosting the refugees for all these years. So right now they are thinking about other projects, not only the social safety net projects. They are talking about the commercial farming project, the commercial fishing project. So all these projects are now in the northern part of the country, and we are seeing us including the refugees in those projects. So I think I will thank you. That's the end of my presentation, and over to you, Zara.
Thank you so much for that, Ferdila, and in all the planning calls and things that we were doing. It's always really interesting to see global commitments that translate to actual programming. I come from, my background is very field and operational and getting things done, and I don't tend to pay attention to what's happening at the global level and how it's actually going to impact me. So I think, looking at this case study, especially, you really see what that looks like, and what this IDA 18 funding, which we are going to come back to, because it is one of the big questions on the humanitarian side, especially, and for practitioners, how do we access this funding? How do we work with this World Bank funding? What is the different funding mechanisms? The other thing that was super interesting that you were talking about, and we've seen this come up many different times, is the software of preparedness versus the hardware of preparedness. We can talk about our systems being shock responsive or whatever it might be, but this element of advocacy, the fact that, you guys had 2 years of conversations and discussions, and here with COVID, there's this pleasant surprise that, refugees, foreigners, etc., people who are not normally part of a social protection system are just automatically, like, it's not like, oh, okay, in cash we always say, like, it should be the default, response for, you know, humanitarians or whatever. And here we are with the inclusion being some sort of a default response, like it wasn't even a question. And I think the importance of that really needs to be stressed. It did come up in our first webinar where we did have UNHCR as part of that first webinar, Annika Sjoberg, the senior cash officer at UNHCR, and she really was highlighting the point of advocacy and how incredibly important that is as well, especially in a situation like this. The last point that I wanted to highlight from your presentation before I hand it over to Thais to be able to take it forward, because it connects to what she's going to talk about in terms of Brazil, was that UNHCR was just calling up community leaders to make sure information was going to the refugees. So it's not like you were actually doing something like an implementation role in that way, like handing out money or something like that, but making that connection. And that's a really complementary added value thing to be able to do, so that refugees have the information and that they can access the services. So thank you so much for that. I do want to encourage people to continue to put your questions in the chat box as much as possible. We will go to our last presentation from Thais, and she's going to present Brazil for us. Thais, over to you.
Thank you, Zira. So I think that before starting my presentation, I think if you could go, yes, thank you. I think before starting my presentation, I just would like highlight that it will be focused mainly on the Venezuelan population here in Brazil, because AFSI Brazil works with this population here. So the panorama that I will provide here also applies to people from other nationalities, but I will use the example of the Venezuelan people here. So very briefly, AFSI Brazil is an NGO that is in Brazil since 1984. We are part of the AFSI Foundation network, and we're working in many different areas of intervention, always targeting at the human development of people. And one of these areas is the migration field. We have a very important partnership with UNHCR here in Brazil. We established it in 2018, 2 years ago, which is focused on the Venezuelan population here in the state of Roraima. The state of Roraima is the north part of Brazil. Well, Brazil is the 5th largest host country of displaced Venezuelans. And most of them arrive through the border with the state of Roraima. So for these reasons, and because we at AFSI and UNHCR are partners of the Operation Welcome that I will explain, that's why we established this partnership. Next slide, please. Well, what is the Operation Welcome? It is a humanitarian task force that was established here in Brazil in 2018, and it's led by the Brazilian government with the participation of the presidency and 11 ministries here. And there are more than 110 agencies and civil society organizations that are engaged in this operation. Well, the purpose of this operation is to respond to this massive inflow of Venezuelans here in Brazil that started some years ago, and assisting them to rebuild their lives and really integrate in the Brazilian society. This operation works with 3 main axes. One of them is the border management, the other one is the sheltering, and the third one is the voluntary internal relocation that we call interiorization. I'm just bringing it here because when we talk about this first axe of the border management, it's very interesting to highlight that when the Venezuelans arrive at the border with Brazil, they immediately get their residency and refugee protocol here in Brazil. And in a very few days, like in 15 days, they get their national documents here, like ID, work permit, and etc. So they are granted with the same rights of any other Brazilian has here. Next slide, please. talking about specifically about the social protection system here. Why I said that this documentation are provided so quickly, because they give access to these Venezuelan refugees and migrants to many rights. So they have access to basic and social services. They are included in activities of socioeconomic inclusion, and they also have access to social policies, including cash transfer modalities. Here I can highlight three main programs and initiatives that we have here that benefit this population. We have the CBI, that is the cash-based interventions that is provided by UNHCR here in Brazil. We also have the Bolsa Familia, that's a governmental program that is targeted at the most vulnerable people. And a third program that's called BPC. It's a continued benefit for elderly people and people with disabilities. So this was in place before the COVID, and now during the situation of this pandemic, what we have the same rights, so people still have the same accesses and rights here, including these programs that I just mentioned. But the government decided to reinforce some initiatives and create others. So they decided to reinforce the Bolsa Familia. So people that received less than 600 reais are having this income supplemented to reach up to 600 reais. And other people that fit the specific criteria that are mentioned here in this slide, they can receive from 600 reais to up to 1,200 reais. Both benefits, both situations, up to 3 months. In addition, the government decided to provide a special aid for the population. This special aid also goes from 600 reais up to 1,200 reais, up to 3 months. And they also have specific criteria for people apply. What I would like to highlight here is that the refugees and migrants here, they have access to all of these benefits. Even people that are in irregular immigrant situation here, they can access them. The only thing is that they just need Brazilian documents, Brazilian ID, some specific documents. Another thing that I would like to highlight here, and it's very important, is that people that already received the Bolsa Familia, they can have access to this special aid. The only thing is that they cannot have cumulative benefits. So people receive the amount that represents the greatest value for them or for the family. Next slide, please. And what about the humanitarian actors here, the UN agencies and NGOs? What are they doing here in this COVID-19 situation? Well, they are working really strongly, work together and implementing a lot of initiatives. So in complement to the government assistance, well, the organizations are still working together, coordinating their activities, having their priorities adjusted to the COVID situation. They are helping these people to have access to some documentation, because some police stations and etc. are closed, so they are helping people how to manage that. They are helping this population to access the governmental aid and support and assistance. Other initiatives that are related to the prevention of COVID are also in place, like the provision of hygiene materials, organizing isolated spaces in shelters like in the state of Roraima, providing information about the COVID prevention. And another thing that's really interesting is that these organizations are continuing some activities that envision the long term. So they are still working with the private sector to sensitize them on hiring refugees and migrants. They are working on online training courses like in Portuguese language and in professional courses. So there's a multiple and complement initiatives that are in place right now. Next slide, please. And well, what do we have in terms of medium and long-term perspectives? As I said before, this refugee and migrant population in Brazil, they already had legal access to work permit, access to health, education, and social assistance. Obviously, Brazil also works with another project with the Venezuelan people that is funded by U.S. government through the BPRM. And we had an experience like working with these people, terrorizing them to the south of the country. And some specific people that were not working, like wives or the parents, elderly parents, they had access to this kind of social benefits that Brazil provides. But in the future, what do we have? Well, these rights will still be granted for sure, they are assured. But we expect that this situation brings more visibility for this population's needs, and we are really confident that we know that they will continue to receive the support from civil society organizations, UN agencies, and the government included. We expect that the private sector are still being engaged in hiring and including migrants and refugees in their recruitment process. They are already being sensitized about which is the added value of this. But we, of course, are aware that the economic recovery here in Brazil will be slow, and this population will be affected, actually, as Brazilians are being. But in the long run, we expect that more economic opportunities will be put in place for refugees and migrants. So, Zira, back to you.
Thank you so much for that. And you can actually stay on camera and we'll get everybody else on board as well. No, that was a super interesting example. And again, it's these are the good practices that we're seeing around the world in terms of, inclusion. And a lot of times it's been that the inclusion was already there, that a system was able to be shock responsive to get people in. And some of the key things that have come across from your presentation that I wanted to pick up on is, again, the preparedness side of it and partnership and collaboration, that all these agencies are working together in order to meet needs of refugees, but also, again, like we had talked about with the Republic of Congo, it doesn't have to be the actual administrating of the cash itself. There are other ways in which humanitarian agencies or UN agencies or development agencies, civil society actors, that we can be looking at the inclusion and ensuring that people have access to cash. One of the big things is Andrew also with us. Andrew, if you would also like to be able to come on. There is, we do have a couple of questions that have been coming in, and please state we can go to the question and answer slide all the way at the end of the presentation. But yeah, if you can state your name, the agency that you're with, if you are with an agency and you feel comfortable telling us which agency, and your question, that would be very useful for us to have. And if your question is directed to somebody specifically, we're going to try and bundle up the questions as much as possible. We would like to be able to run the next 30 minutes that we do have as more of a panel discussion and conversation. So even if I'm directing a question to one of the speakers, any of the other speakers are more than welcome, especially if you've got some concrete field examples to bring up to be able to talk about it. I'm trying to figure out where do we actually want to start with. right now. But we'll go with one of the big questions that we have around data protection and inclusion of refugee populations or forcibly displaced populations. What does that look like to get inclusion of these populations on the data protection side? And Mamadou, given that this was one of the key things coming out of your presentation to begin with, it would be great to hear from you and for the other speakers, especially if you have that example at the country level and what sort of problems you may have had, challenges you might have faced. Just go like this and we'll get you in right after. So Mamadou, over to you.
Thank you, Zara, and thanks really, many thanks to Ferdila and Thais for these very good case studies. I think they are extremely helpful and they'll exemplify some of the key messages, the need for an enabling government policy and as well as the support from the international community when it is required, or from the general public in countries that do not need it. One question was asked about data, but if you allow me, Zara, I would like just to speak a bit more about some of the basics about refugee protection. One of them, in fact, is that what you need when you are in need of international protection is not necessarily to come to UNHCR. As the example from Thais showed, it's the government authorities that welcome you, that provide you with either a type of registration document, pre-registration document, and when required possible, UNHCR can work with government, advise them. This is one of the responsibilities the organization has since 1950. Ferdila also spoke about the areas where you find refugees from CAR, from Rwanda, in the Republic of Congo. These are also received by the government authorities, sometimes with the support of UNHCR. And when government do not issue themselves documents, UNHCR can issue them. And then depending on the context, if you are in urban settings like Ghana, you have a Ghana Refugee Board that is mandated by the national legislation. And I understand that the colleague who asked the question is from Ghana. The Ghana Refugee Board issue you with a document, and having worked in that region many years ago, I know that we help the authorities to determine this. But since then, one of the best examples we have now with digital type of documentation is in Ghana today, and which is well aligned with type of identity document that are being issued by the government for Ghanaian nationals. So I wanted first to start with that. And then secondly, when it comes to accessing or inclusion into the National Social Protection Scheme, the reality is that data is of course preserved as much as possible. In most of the countries, you've got laws governing data and data sharing, but also at the UNHCR level, we have very strong policies relating to data and data sharing. And very often, before data is shared, where it is UNHCR that has collected it, we do work with the government, we get the consent from the individual, we work with the government, and as in order to make sure that the data is being shared for an intended purpose, and that purpose is for accessing the benefits that have been indicated. Now, within several governments, you can see some of them that want to look at, who looked at protection, security, and all of that. They can need all the data about the individual, because this is part of their own responsibilities. But institutions that are there to provide support, social benefit, usually only need part of the data, including around vulnerabilities and all of that. So we do have many of these examples that could be shared, and we have them. In addition to data, if you allow me, I wanted to say again how inclusion really takes time. You highlighted it, Zara. the reality is, even when you have an enabling protection environment, and 2016, Ferdila also referred to it with the New York Declaration, the Comprehensive Refugee Response Framework. I was personally in charge of its rollout in 15 countries in Africa, Asia, as well as the Americas, Central Americas, and Mexico. It shows you that even when you have that very good energy, positive energy towards solidarity, international solidarity, it takes you years to have pledges being implemented. The Republic of Congo was one of those that made pledges at the Leaders Summit in September 2016. Ethiopia was another one. Uganda was another one. They made these pledges, but for them to be really translated into enabling policy environment, to be translated so that they can reach the household level, the individual, so that she or he can benefit from it, it takes 1, 2, 3, 4 years. So Andrew, at some point, will refer to a paper we're working on now on social protection as part of COVID, and how we should not be missing these opportunities. We insist there on that enabling protection environment, but also the time that it takes to materialize them. What you refer to from global commitment to realities on the ground, Zara, in one of your points. So I wanted really to share this, but also to say that these processes and inclusion takes time. They require support. And when you have strong government like Brazil, it is absolutely fine. When you have Portugal that has taken some of these measures, it is fine. But if 85% of the refugees find themselves into countries that are faced with development challenges of their own, it really requires step up from the international community. And that's where the World Bank, that's where regional development banks, that's where other development institutions come and cement and complement. That was really the first objective of the Global Compact on Refugees, which is easing the pressure on host countries, and this requires time and international effort and greater international solidarity. I just wanted really to emphasize those as you move into the next questions. Over.
Thank you. And Ferdila, I'm totally going to put you on the spot. I haven't even been able to like chat this out to you on our back end. You know, is there something that you can say in terms of, you know, we've talked about this global stuff and all the time it takes and all of this stuff and it going into the reality part of it. Is there stuff from, you know, your context that you can sort of talk about? Like, what have the frustrations been? I think it's important that we talk about that as well. You know, it's great that we've got a bunch of successes or whatever it might be, but it's challenges that we really, really learn from. So if you can talk a little bit about that, but also, you know, I don't want this to become too much UN, World Bank, etc. heavy, but if you have something to add as well around, you know, the different the different partnerships and the different actors that you've been able to work with on this. Sorry, it's literally that question is coming at you from nowhere, but I did warn everybody in our planning meeting that this might happen. So Ferdila, over to you.
Okay, maybe if I want to talk about frustration, I think initially when we were not able to get anything from the government regarding inclusion, it was very frustrating at the beginning of the process. Very difficult because they were of the view that refugees are the responsibility of UNHCR. So UNHCR should take care of the refugees. So the whole conversation was also about that, reminding them that they are the ones who are the primary responsible for the refugees, and we are here to support them. So one of the frustration would have been that one, like we were not on the same level of understanding with the government regarding the treaties or the conventions that they have signed themselves. Regarding the collaboration with the World Bank, maybe one thing also I want to highlight here, it was very difficult to move them to the northern part of the country. First of all, because logistically it's very, very difficult to get there. We were there with Andrew, You have to go on the river for hours. We have one plane going there once a week. So it means when you go there, you are stuck there for 1 week. There's no way to come back to the city. So to have a World Bank colleagues going up there was very, very also difficult. We supported logistically, but you know, they were thinking like one whole week in the village somewhere, like, how come? So, but at the end of the day, I think when they got there, they really understood why it was important for them to be there. Because we are not talking only about refugees, we are talking about the host communities who have been welcoming these people for decades and who there's almost nothing for them there. So they saw the reality, and then it was now easier now to go there regularly with the colleagues from the World Bank to go and see. So talking about frustration, maybe I can mention these two things. So your second question was about, sorry, Zara. The second question.
Am I unmuted? I am unmuted. Okay, I can't see what's happening on my screen right now. No, but just seeing, it was about frustrations, but also seeing the reality of how all of this translates down to the ground. So you can also talk about the successes a bit more if you wanted to.
Yeah, maybe related to the first question, maybe you mentioned that maybe people will be interested in know how exactly they can be considered for this IDA 18 fund. So basically what happened, once the World Bank made a commitment, it was a discussion at global level with our 2 HQ, because UNHCR knew what was the situation on the ground for like almost all the operations. And for the Congo specifically, we were really struggling to find local solutions for the refugees here. So I think that's one reason why our HQ also pushed for the Congo to be considered in this process. But if there is one key word, I think from the bank side, it was really mid and long-term solutions. So anything emergency, humanitarian, they were not really interested regarding this IDA 18 sub-window. I remember when they came here, the country was trying also to talk about the fact that they have an emergency situation with IDPs, but the bank was, they said, no, it's not possible. For this specific fund, we have other trust funds for emergency situations, but when it comes to this IDA 18 sub-window, where we are really looking at how to have host communities and refugees tapping into solutions, concrete ones, mid and longer term ones. So I think that's one major thing. And then you have also eligibility criteria. For a country to be eligible to access this fund, you need to have at least 25,000 refugees on the territory, or 0.1% of the population, which is refugee. You also need to have an adequate protection framework for refugees, and that one was very, very important in the process, because they asked UNHCR to assess the refugee framework here. Is the government really respecting its international obligations? I heard about, for example, the case of Cameroon. At the time, they had to stop the whole process because the government was involved in a huge refoulement situation. So really, that protection side is very, very important in the discussion. And the third criteria is that the government should have a strategy regarding long and mid-term inclusion or solutions for refugees. And this one was also very important because that's where we had the government sitting at the table and reflecting, like, how do we include the refugees? And this is how they came up with this social protection program in the Congo, and then other things also that they add in the strategy. Over to you, Zara.
Thank you so much for that. I mean, so much to unpack there. And, you know, the role of governments and what is the incentive that a government may even have, or, you know, what is that business case, in fact, for the inclusion of refugees and what we are looking at and into social protection systems, which already notoriously, you know, if the political will isn't there, people will be like, oh, we can't fund it for our own nationals. So, you know, what is that added incentive to be able to take forcibly displaced into your systems? With that, we are going to try and see if we can make this work, but we do have a speaker from the government of South Africa, Ms. Tema. We are going to try and unmute you, and as soon as you are, there we go, we can hear you. So it would be good for you to be able to just introduce yourself very, very briefly. We've heard amazing things about, South Africa and inclusion. So it would just be really good to hear from your perspective, from the government perspective on this. Over to you, ma'am.
Good afternoon, colleagues. I believe you can hear me. Can you just confirm?
We can hear you loud and clear.
Okay. My name is Lebo. My surname is Tema. I work at SASSA, which is South African Social Security Agency in South Africa. I'm at head office. My responsibility there, I'm the senior manager in operations management, meaning I'm responsible from the time the person steps into the organization to come and apply for any social assistance until she gets to payment. So that's basically what I'm responsible for. We develop systems and programs and processes just to make sure that we are forever improving our space so that we offer our services as speedily as possible so that our turnaround time is shorter. Just as a way of a background, we started with a turnaround time of 90 days from the time the person comes to apply. Now we are at a turnaround time of 5 days, but the majority of the applications that we process are completed in 1 day, meaning the person comes, if they have everything, they are sorted, they go out with their outcome letter. That being said, maybe let me move to who are we as an organization. We are established under section under Social Assistance Act. We are a government agency. We're responsible for administration of social grants. And we've got different types of those social grants. We have a care dependency grant, child support grant, disability grants, both permanent and temporary. We offer foster care grants, and we offer grant in aid, including old age grant. Noting that I've got 3 or 4 minutes, I'll just fly over unless I'm allowed more time. And in terms of the refugees, we are very passionate about working with refugees, and I believe as an organization or a government agency, we're doing very well because we work in collaboration with institutions like UNHCR. They are with us most of the time. We also work with Home Affairs. So the services that we offer are not, many of them we are dependent on the partnership with other government departments. For example, if a person has to come and apply for any particular grant, for example, let's just take a foster child grant. We need a social worker, we need the court to issue court orders. So we are dependent on other institutions, meaning we cannot do without Home Affairs, we cannot do without the Department of Education, we cannot do without municipalities for other grants. In terms of the refugees, we offer support for refugees, and the support that we offer them is almost the same as a permanent resident in South Africa or residents. We support refugees as long as they are legally, they came legally to our country and they have their Section 24 permits. So it's almost the same as the benefits that they would get if they were South Africans. There are still ways, where we are working very hard towards looking into what can happen to asylum seekers, but right now it's issues under discussions. We are not yet assisting asylum seekers. Just in numbers, for April alone, we paid 22,364 grants to refugees. Those would be all the different types of grants that I've mentioned earlier. And for the month of May, we've already paid 22,572. So if like for now, during this time whereby we had COVID-19, there was lockdown, people were not able to renew their permits. The government also took a resolution through the Department of Social Development and our minister that we would not suspend the the grants that are paid to this to refugees simply because of COVID-19, because they were not able to renew their documents because all the other departments were closed. Like, for example, the Department of Home Affairs, where they would normally go to renew or get their papers right. So that extension has been granted until the end of October this year, 2020. We'll see as we move towards that date as to what is the impact, how fast is Home Affairs working in terms of fast tracking the issuing of documents if they have expired. But right now we did not lapse or terminate any of those grants. I'm just getting my next slide. This one is done, this one is done. Okay. In total, as SASSA, we pay 11,349,457 grants or social grants on a monthly basis. I'm talking about the beneficiaries that we are paying. So a beneficiary would be like myself, but you find that under my name, I've got children, my grandmother, there are people that I'm getting social grants on their behalf. So what happens in that space is that's why we would always say we're paying more than 18 million. So the 18 million is when we count individual grants. But when we count the people that are receiving those grants for themselves or even on behalf of others, then we're talking about just above 11 million. Just as of yesterday, in total, we paid 20 billion and 62 million. The number is too long. I don't want to cut my tongue with this number, but it's just above 20 million that we're paying. But in this 20 billion and 11 million, the refugees are also included. So I was just giving you a picture of the amount of work we do. And going forward, we also we also offer a program. We have a program that is called Social Relief of Distress. We've got 4 categories. We provide support when people do not have means to support themselves. So refugees also benefit from that, just like South Africans. We've got a school uniform program whereby people have kids, they cannot afford school uniforms, shoes, or whatever. We provide that. And even if we provide that to the value not exceeding 2,000 rands per child. However, if it's children with disabilities and they require, for example, special shoes that are more expensive, we just put a motivation that for this particular child, their budget for school uniform should exceed 2,000, and then we would list the reasons, because we do not want to disadvantage them. On this program of Social Relief of Distress, simply put, we support anybody who doesn't have sufficient means to support themselves. We provide that again in terms of cash, more especially if there's a disaster and people lose, and maybe people are displaced, like we're just talking about displaced refugees. With us, we do the combination of South Africans and both and refugees. They would be housed in a shelter that would be appropriate for that time. When they are there in the shelters, we do not give them money or maybe food packs or relief parcels. When they are there, we give them meals and we provide them with vanity packs, mattresses, blankets, whatever a person needs to take care of themselves, like you and me if we were to wake up without nothing. So even if they've got babies, they'll get baby food, baby packs, they would get nappies, soap, toothbrush, you name it. They would get that while they're in the shelter, and they'll all get 3 meals per day, cooked meals. But as soon as they leave the shelter to rebuild their lives, we give them what we call social relief parcels. It's a food, we used to call it food parcel in the past, mainly because in the past it only consisted of food. However, in collaboration with the Department of Health, we had to audit what is in the pack, because it was felt that what we give a family should cater for the needs of the children and the needs of the adults. So we made sure that the cereal for the morning, and there's dry food like your staple foods, there's your fresh produce, fruit and vegetables. So at least the child can have a good breakfast in the morning. They would have a what we call maybe a fruit, banana or orange to take to school. Then when they get to school, there's a school feeding program in South Africa. So it's more like a cycle. They get food at home from SASSA. Then when they get to school, they get food. When they come back, the food that SASSA had given to the parents is available for the children to eat. And we also have a very program that we are passionate about that we call a zero hunger program. We target children up to the age of 5 who are having nutrition deficiency challenges in their homes if parents maybe cannot afford to feed them. We put these children, in fact, let me just explain the process very quickly. The parents, the children are identified either by the Department of Health or they're identified by the school teacher or school principal. They will give us a list of children that are not so well taken care of in their homes, more especially when it comes to nutrition. So would identify thousands of them across the whole country and put them on a 6-month program. What happens there is that the school identifies, health comes, they take something that we call MOAC. They measure their circumference, their height, their weight in line with their age. And then we put them on the program and feed them nutritious food for 6 months. And in the process, we're also teaching the Department of Health will also impart skills in terms of how to prepare food, how to take care of their children. So it's a joint effort. However, then I need to come to my last slide.
Yeah.
Where I would talk to the impact or the safety net that we have put in place in response to COVID-19. As SASSA, we realized that, like in the beginning, I told you how many millions of people we support per month. And you would understand that the staff capacity or employees that we need to have in order to cover everybody. So COVID-19 landed, we were not prepared like any other country. What we did was, okay, now people are now going to lose their jobs. What is it that the government can do? What first came in was that we need to increase the amounts of grants that we were giving to everybody. For child support grant, the grant was increased by 500 rands. And then the other types of grants, we topped them up by 250, except care dependency grant because you're paying both the parent and the child. So the money there was seen to be adequate. What we also did was to look at how long do we take to process, how feasible are we going to be able to assist people, because they used to come to our offices where we take the applications, they have to sign, they have to put their thumbs and every other thing. So we saw a benefit out of this COVID-19, even though there's a pandemic, because now we had to work smart. So a decision was made that they can apply remotely through SMS, WhatsApp, email, whatever method. And we had to shorten our application process so that we could help as many people as possible in a very fast and efficient manner. And again, one good thing that we did as an agency is that we realized that many South Africans were now could not maintain their livelihoods. They were without money, they were under lockdown, they could not work. That's when the 350 temporary 350 social grant relief was introduced. So for those people that fall in between, like they are not working, but maybe it's, let's say, university students that would have been at home and not working and they don't have a bursary, or people who used to do temporary jobs like our domestic helpers who could not travel between their places and their place of work. So those are the people that are getting 350 temporary grant that started in May and it's going to end by October 2020.
Thank
what
you.
Also happened.
I'm so sorry because I hate having to do this, is interrupt in the middle. It would be, first of all, is it possible for us to turn on your video? Are you comfortable with us doing that? I didn't realize that we were going. Sorry?
You don't have a problem, it's fine.
Not a problem? Okay, I'm going to see.
Not a problem at all.
Okay, I'm going to see if it's possible from the back end for us to be able to do that for you. But if not,
okay.
but I do want to thank you. I mean, it would be great if you could share didn't realize that you were going to have a presentation. Sorry about that. Maybe there was a miscommunication that we had. No, but it's been absolutely 100% brilliant, because one of the things that ends up happening for us on the humanitarian side is that we don't hear enough from governments, and to hear what are the priorities of governments, how is government actually dealing with this and looking at it. So I have we only have about 4 minutes left for the whole entire sort of presentation, but it would be really good if you are able to do this in 30-45 seconds to sort of talk about, or maybe even less, but if you can just give us a little bit something, advice for humanitarian actors who want to work with government, to support government. And from the humanitarian actor side, we are coming in with wanting to do cash transfers and working with government to do cash transfers and to link our funding to it and to work with that. So it would be good to hear from the government side, what are the two key things that you think humanitarian actors must take into account if they are coming in to work with the government and their social protection system?
In response to your question, my take is, let's first treat every person with utmost respect, and try to find out from them what is it that they would want to be assisted with. Because many times than not, we're pumping money, and one of the people in there could be saying, you know what, if you could skill me or give me some skills, maybe a short course, I'll be able to be self-sufficient. With the refugees that I've interacted with, normally you'd find that it's people who came to South Africa not because they wanted to, but because they were forced to. And you find that the person is educated and everything, so just giving a grant does not really talk to that person, because they also want to live a dignified life. So my view on that one is, in as much as people come, we can feed them, we can give them grants and everything. Let's ask them, what is it that would make you live and provide for yourself and family in the most satisfactory way? So I feel we're not communicating enough. We across the world, programs are just put in place, but do we ever take a step back and ask, how can we help you? So that is my my input. However, I would want to get back to the 350 grant. We did not realize that so many people were in distress. We were expecting as maybe around 5 million applications. We got 6.5 million in a space of between 1 and 2 weeks. We have managed to pay 3.2 million already, and the rest would be paid by the end of the month of June. So my take is, let's give immediate support, but also let's do something for our foreign nationals so that they skill themselves and use the skills they have. It's not like these people of our own do not have any skills. They do have skills. They do want to work. I think 90% of those that I've come across with, they do. So let's open those doors for them. And I think we can all become the world will become a better place for all of us.
Thank you so very much for that intervention. It was absolutely brilliant that you were able to come on and be able to do that. So we will try and get that presentation, or we will get that presentation from you and add it on. Yes, we'll add it to our wrap up that we do, because we will send out the PowerPoint that everybody has used. We will have written responses to the Q&A. I'm going to open it up to the other panelists, given that it is already 9:30 on my side, which means we are out of time. But I want to give Mamadou, Ferdila, and Thais 30 seconds to give us any final comments. And then Andrew, you can also look at 30 seconds from your side. But Mamadou, let's start with you.
Thank you, Zahra, and thanks really to Ms. Tema. I think what she said at the end, I would not have. Do you hear me?
Yes.
Okay, I wanted to thank you as well as Ms. Lebo Tema. I think what she said at the end, I would have never said better than that, and our High Commissioner himself. I think what she said about skilling the refugees, allowing them opportunities to use the skills they have, That's the most important message I think we could have taken out of this. And if I want to link that to one of the questions asked, which is about the incentives, I think the incentives can be not only what government know they can get also out of the skilling, allowing the refugees the ability to work and use their own skills and live in dignity, but also sometimes we need as humanitarian civil society to help government reach to the general public, so that refugees are not perceived as persons who are there just getting hands out. They can contribute, and they can contribute meaningfully to their societies. If we do this, many of the backlashes that we have seen when governments start social protection programs, including refugees in them, we will reduce them. So these are really very important elements, and it takes courage in the face of government and enabling policy environments. I stop there, and I'm sure what I haven't said, Andrew will complement me. Thank you, Zahra, and it was a pleasure also hearing my co-panelists. Thank you.
Thank you, Mamadou. Ferdila, 30 seconds or less. You're muted. Nope, you're still muted. For some reason, we can't hear you. So I'm going to go to Thais really quickly while we figure out your... Yep, Thais, 30 seconds or less, please.
Okay, thank you, Zahra. Well, I think first of all, I would like to say that it was an honor to be today here with you, especially with the UNHCR representatives. I was really glad to be here with you today. And well, I think it is this kind of discussion and dissemination of information is really important right now. I mean, now the most vulnerable are even more vulnerable with this COVID-19 situation. So we have to be really attentive and, you know, endeavor all of our efforts to really help them in this specific situation, and, you know, try to find some ways to connect these aspects of livelihoods and vulnerability, how we work together with them. So that's it. Thank you very much.
Thank you so much. Ferdila, are we able to hear from you now?
You hear me?
Yes. Yeah, more or less.
So I think the one thing I would like to mention is the importance of collaboration. I think from this process here, it was very important to have so many people working together. I didn't mention the NGOs, but they are really part of the process here. The civil society, we work with them throughout the process in the discussions, and also the implementation will involve the NGOs, the local NGOs we have on the ground here. So I think that's one thing maybe we didn't highlight enough in our presentation, but yeah, we have been working with national actors, national authorities at local level, national NGOs, and they are really the core people of the process. So and thank you so much for having us here.
Thank you so much. Yeah. Andrew, I know I wanted to give you like 2-3 minutes in the end, but basically you've got 30 seconds.
Yeah, look, I think what's underlying now is that we've got 77% of refugees in protracted situations, and it's humanitarian assistance is not designed for that. Okay, so really, when we talk about war, what's the role of the humanitarian community? We need to help governments meet certain legal commitments that they've made in terms of refugees and in terms of international law, in terms of the global refugee pledges. And what that means is that we have to put on the table a pragmatic business case. On one side, and it happens over and over again when we're dealing with different governments, there needs to be new funding put on the table for refugee inclusion. We can't penalise other host communities elsewhere. We also have to ensure that any funding that includes refugees will build up the coverage of host communities, and at some stage refugees have to pay into systems. They can't just get social safety nets or social assistance without any hope of actually paying back into social protection systems and taxation. But in response, what we need from governments is we need to open up the rights for refugees to become economically active, to be able to pay, you know, that's the first key thing. The remittances they can bring in, it's a big earner in certain countries. The second thing is we need to scale up the protection capacities of a whole range of ministries, and we need to open up real partnerships with those ministries in conjunction with refugee agencies that are really running the different social protection and labour programs. And that's the pragmatic business case that really shows how both humanitarian development actors can really help governments concretely, you know, meet different international standards and legal commitments pragmatically. So I'll stop there.
Thank you so much, Andrew. Thank you to all the wonderful panelists for everything that you were able to bring to this. These webinars are always a little bit nerve-wracking. I mean, I hate being on camera, but yeah, so these are always a bit nerve-wracking, but all of you, with all the work and everything that you've put into this, have made this an absolute pleasure. Thank you to everybody who joined us. Look out for the summary blog. We will take the question and answers that have not been answered, etc., and you will be able to receive those, especially if you registered for the webinar. Our next webinar is on the 16th of July, and please fill out the feedback form that you will get from socialprotection.org when you click out of here. Well done to those who managed to stay on till the end of the webinar. We know it's quite long with 90 minutes, and thank you again, everybody, and we will see you next time. Stay safe out there.
Thank you very much.